And lastly, class, no, is our subjective data for this session. Okay, so I have changed the formatting. No, I am now using my notes, so para dili na ko magsuwat. No, so for chest pain, no, if severe, if we have to assess first is the characteristic. Okay, dapat mangutana ta about their characteristic. Now, class, if the characteristic is severe, crushing, or squeezing, that is a possible sign of angina pectoris, or what we call chest pain. Diba? Okay, what we do there is we ask the patient to rest. If it does not subside after around 5 minutes or 15 minutes, so on and so forth, then you go to the emergency room. Okay? Emergency room dayo na siya. No? Aside from that, class, we also have what we call our palpitations. Now, palpitations, class, are caused by problems in our conduction system. If a patient has a palpitation, it causes them anxiety. Okay? Anxiety. No? Next is fatigue. No? Fatigue is a results from compromised or decreased cardiac output. When we are assessing fatigue, it is essential to ask them their recent activity. Okay? For example, sir, what did you do this morning? Okay? If it is either what we call kanang tiring ba or not, kapoy ba or dili. Usually, fatigue is worse in the evening. Okay? It is worse in the evening. Next is dyspnea or difficulty breathing. Dyspnea or difficulty breathing, again, we have to ask them for activity. Okay, so man nilang gibuhat ng exercise ba sila dili. If it is exercise, okay, dyspnea is normal, di ba? Dyspnea is normal as long as dili lang dugay, di ba? As long as it does not last for long, no? Obviously, maggisod yung ginhawa after exercise. Okay? If it is not from exercise, it could be a sign of congestive heart failure or pulmonary disorders like we mentioned, no? I mentioned in the last topic. And next is dizziness. Dizziness is caused by decreased blood flow to the brain, possibly because of myocardial damage. Okay? Possibly because of myocardial damage. Now, if you have to remember, there is always a risk for falls when it comes to dizziness. So, when there's a risk for falls, it is best to assist the patient in mobility or moving. Diba? Paubanan mo sila. Sir, paubanan ta kauban sir para dili ka matumba so that you will not fall. Ayan. Okay, next is edema. Okay? Edema, specifically of the ankles, feet, or legs, could possibly be right-sided heart failure. Okay? Right-sided heart failure. Or it could also be venous pooling. Diba? Venous pooling or venous stasis. Next is previous or current ECG. Now, the reason why we have to get previous and current ECG is so that we can compare past and current results. Okay? Current results. Okay? This will allow us to detect changes in conduction patterns. Changes in conduction patterns. Aside from that, it helps the healthcare team evaluate changes in cardiac conduction. Ayan. We also have to ask them about medications. Now, normally, class, no, if you know, the highest kanang what we call this morbidity kan disease, highest amounts of morbidity in the Philippines, actually in most of the world, no, is related to heart disease. Now, most often than not, no, our patients will have maintenance medications for these diseases. Okay? Ang tendency man good is if they have maintenance, okay, they might forget. Okay? They might forget. Now, first, when they have maintenance medications, the first step we do is we document. Ato is what? We document. This is to avoid polypharmacy. When we say polypharmacy, class, it means over-prescribing. Okay? But, next is to check compliance. Ato kitaon, class, we will assess if they are constantly taking their medications. Mga ka, sir, regular ba ang imong pagtumar sa imong tambal? Okay? Like, dili ba ka mo skip? Dili ba ka di ba nimo pasagdan? Okay? There is a tendency, especially ang mga elderly, that they might forget Okay? They might forget about taking their medications. What we need to do about that is we have to educate them. Okay? Educate them about their medications. Imo sila storyan, sir, dapat mo to mark ani na tambal, sir, because this medication is used for blah 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 blah, para sa imong heart, no? This to, let's say for example, prevent your blood pressure from growing high. Diba? Para dili mo saka ang imong blood pressure. So mo na siyang imo isulti, no? That is the reason why, class, kinahanglan yun. It is very important. Maminaw mo, it is very important that you are a master or at least good at pharmacology. Kaya ang tendency na is mangutan na dyan na your patients will always ask questions. Okay? Mangutan na gina sila. Aside from that, here is the thing you have to remember. Here is another thing you have to remember. You have to remember, class, that maintenance medications are also a problem of logistics. Maybe messy lang or wala nila ma-manage ang ilang mga medications, no? So you could also educate them on using what we call pill sorters. Kana bitaw mga butangan nagtambal, nga na ay date and then ay time, no, like Wednesday 8 a.m. 9 p.m. kaya para so that their medications are organized, no? Next is blood pressure monitoring. Now, self-monitoring, class, is recommended. When we say self-monitoring, it is when you yourself, no, if you are the patient or if the patient themselves, no, monitor their blood pressure at home. Okay, this could be either using a automatic blood pressure monitor or if they have a caregiver or a relative na kamao mukuha og blood pressure, then that is recommended. The reason why that is recommended is so that they will have a consistent knowledge of their current blood pressure. Now, class, if they want to monitor themselves, or if they want to learn how to monitor their blood pressure, please do not hesitate to teach them. Tudloan mo sila. Actually, class, the process there is demonstration and then return demonstration. Mag-ret them mo. Demo and ret them. Ang mahitabuan na, class, is you will demonstrate to the client first. Okay? And then, the client, mura siyag student, they will return that demonstration back to you. Okay? If you notice any errors, diha na kamo correct. That is the reason why kamo, you as students right now, you also have to master our skills. Diba? Okay, because there are tendencies, there are times na dapat imuha na siya i-teach. Alright. Next is activity. Now, class, a sedentary lifestyle or a passive lifestyle contributes greatly to heart disease. Okay? Contributes greatly to heart disease. Okay? Now, class, it is recommended, no, that for a normal person to have aerobic exercise at least 3 times a week for not 3 minutes, class, 30 minutes. Okay? Muna siya, class, no, it is recommended so that we can keep our fitness level in check. Para sakto lang atong fitness level. Next is self-perception. We ask questions like, what fears do you have about heart disease? No? Tendency mga good, class, is they will have decreased self-esteem. They will have decreased self-esteem, okay? Because their self-esteem is tied directly to their ability to perform ADLs and usual familial roles, okay? ADLs and usual familial roles. Like for example, class, a basketball player is not allowed to play basketball anymore because they have a heart condition. Obviously, their self-esteem will be affected, di ba? Their self-esteem will be affected. Mas na, Allah, masakit to naman day ko, hindi na ako pwede mo duwag basket, di ba? No? So, mo na siya, no? In that instance, no, what you do is you have to provide them with alternatives, okay? For example, basketball, di ba? Basketball is a very demanding aerobic sport. It is also a contact sport, di ba? So, maybe you can tell them, sir, if you really want to exercise, sir, I know that basketball is very hard for you to give up, but maybe you can try swimming, okay? Swimming, although it is aerobic, no, it is not as physically straining compared to basketball, di ba? Ayan. Next is skin color or texture changes. We have already discussed this before, di ba? Katong mga cyanosis, pallor, so on and so forth. Nagbalik-balik na lang na sila, class, ang cyanosis and pallor. I just want to highlight texture changes, class. When there is decreased blood flow to an area, when there is decreased blood flow to an area, there is a tendency, manggod, no? There is a tendency of what we call wrinkling of skin. Ang imong skin kay mo wrinkle. Ayan. Next is leg and leg vein irregularities. Okay? If you can find, or if you can palpate, or if you can see or inspect bulging rope-like leg veins, this is possibly varicose veins. Okay? This is caused by venous pooling or venous stasis. As I've mentioned before, this is most likely due to standing for long periods, such as during kanang mga trabaho ng mga magtindog, no, para ng mga nurse. Okay? Varicose veins is also common for kanang mga pregnant mothers. Okay? Next is arterial wounds. Arterial wounds, gani class, since they are pressurized, they tend to be very painful. Okay? Arterial wounds, okay? When we say arterial, apilang disease, di na siya apil. Okay, arterial wounds, mong good, it means that the wound, no, kanang imong samad, it affected or it hit an artery. Igo ang imong artery. It is often painful because it is pressurized. Often we can find them on the toes, foot, or lateral ankles. Lateral ankles, gani, side of the ankles. Okay? Our venous wounds or ulcers are often painless because it is not a pressurized blood vessel. It is not a pressurized blood vessel. So, this is often seen in the lower leg or medial ankle. Medial ankle, gali, in the middle. Okay? And if you, for example, inspect swelling in the feet or legs, this is probably caused by venous insufficiency. Okay? Venous insufficiency or decreased venous blood or blood pressure. Now, class, okay, venous insufficiency, this could also be caused by what we call our right-sided heart failure. This occurs in DVT or deep vein thrombosis because ingani man na siya, class. Oh, diba na to? Okay, na ay clog dire. So the blood cannot easily enter your it's gonna climb back to your veins, no? Back up sa imong superior part of the brain. So ang ending ana is more blood will pool on the lower side before the clot. Ang ending ana, class, is most of the blood, kadaghanan sa blood, they will exit the blood vessel. Diba? Because if you remember, the blood vessel is semi-permeable. Okay? When the blood enters the blood vessel, they will enter what we call our interstitial space, wherein now, mauna na siya makakause og swelling. Okay? Okay? Mauna na siya makakause og swelling. And lastly, we have saved the best for last, no? As we always do. Okay? Cigarette smoking. If you know, cigarette smoking increases the risk for heart diseases and chronic arterial insufficiency. Now, what you do, class, is you document what we call our pack years. Okay? For example, class, pack years is computed by asking the patient how many packs they consume per day times multiplied by the number of years they have been smoking. For example, my packs per day is around 0.5, which is around 10 sticks. Okay? Kaya usa ka pack, 20 man na ka sticks. And I have been smoking for around 12 years. So, 0.5 times 12, that is my pack years. 6 is my pack years. Mo na siya ang imong i-document. Alright. And with that,